Welcome, delegates, colleagues, members, and partners. Today I'm privileged to speak to you about the value of the national aquatic industry, an exciting project undertaken by Royal Lifesaving Australia and PricewaterhouseCoopers. So I'd like to start today with just an overview of what I'm going to talk to you about today. I'll start with a bit of background to the report, why we chose this report, and some of the environmental and contextual factors that influenced it. I'll show you the results, the high-level results of that report, and I'd like to talk to you a little bit about the methodology, how we did the research. And then finally, I'll finish up with our next steps and future directions. What does the report mean? So to start with, for almost every Australian, at regular points in their life, the local pool has played an important role as a place of recreation, learning, fun, or fitness. This is not surprising given that 89% of Australians live within 20 minutes drive of their local pool. Before we jump into the results of the report, which you may have seen on social media or in industry publications, I thought I would start with telling a little bit about the background to why this report was undertaken and why we did it at this time. Even before the COVID-19 pandemic saw aquatic facilities and swim schools close their doors to their customers, their communities and their staff. For a long time, Royal Lifesaving has been advocating the broader health, social and economic role that aquatic facilities and swim schools play in creating a healthier, happier and more prosperous Australian community. Our mission at Royal Lifesaving is to create a water-loving nation free from drowning. And public swimming pools provide the necessary foundational skills to facilitate a lifelong enjoyment of water, as well as a place to learn water safety skills. The report findings show that the swimming pool is part of our national identity. Aquatic facilities are visited over 333 million times per year by Australians, and the popularity of swimming is increasing, with participation at a 20-year high. In 2020 alone, despite the closures brought about by the COVID-19 pandemic, 17% of all Australians swam, an increase from its lowest participation rate of 14% in 2010. In regional communities and remote areas, aquatic facilities can play a crucial role in the community, promoting social interaction and well-being. Aquatic facilities built in remote communities provide safe and cool recreation opportunities for community members living in typically hot locations. So the impact of COVID-19. The aquatic industry has been significantly impacted by lockdown closures associated with COVID-19. As one of the first industries to close and the last to reopen each time there was a lockdown, all 2,113 aquatic facilities across Australia were forced into closure at some point throughout 2020, causing an estimated 67,000 frontline workers to be stood down. Despite the adverse effects of the pandemic, the aquatic industry is uniquely positioned to provide an important resource in the nation's recovery. So why did we conduct this report? Why now? If we think about the industry and the climate in a non-COVID time, from a funding perspective, aquatic facilities have always competed for resources. We know from our work with government that increasingly their investments need to factor in the overall social health and economic outcomes or impacts of that investment and compare these outcomes against other opportunities. Other sectors have significant lobby groups and think tanks which ensure they are well represented in these types of conversations. Even as we look to the water sports sector, a comparison case study might be the AFL, who in 2014 released a series of studies about the social return of investment for a football oval. And they estimated that at about $4 for every $1 invested. And we've seen since 2014, the AFL has invested significantly in social impact research for all of their programs and activities. Correspondingly, we've seen an enormous investment in football and other sports infrastructure ever since. A recent media release by Sport and Recreation Victoria, for example, cited that there's been $1.1 billion of investment in community sports infrastructure since 2014 in Victoria alone. So this investment has gone hand in hand with a clear shift towards measuring and reporting on social impact. While we had previously at Royal Lifesaving completed a study into the economic benefits of Australia's public aquatic facilities, which was published in 2017, we looked at those benefits on a per visit and per facility basis. And this time we wanted to advocate the industry as a whole, and we wanted to look at it on a yearly basis. We also wanted to leverage the opportunity to create better data on aquatic facilities and swim schools and work out exactly where in the map each facility and swim school in Australia is located in the first ever comprehensive aquatic industry infrastructure database. Another significant factor that emerged out of COVID-19 is that we learned that the state and territory public health policymakers did not seem to understand the aquatic industry very well. At times, the balance of risk versus benefit from policymakers seemed to have been in constant flux throughout the pandemic. Sometimes bizarre misunderstandings or oversights saw pubs, nightclubs, and even brothels open before swimming pools. Where other sectors knew their impacts and had quantified them well in advance, our sector had not. So there was a clear need to advocate the broader impact that aquatic facilities play in their local communities. Finally, the Australian Water Safety Strategy has long advocated that we need to conduct research into the broader health and social economic role of aquatic facilities and swim schools, and we wanted to deliver on that strategy objective. The Australian aquatic industry plays a key role in implementing the water safety strategy, including providing safe spaces to swim with trained lifeguards supervising, increasing the number of people in the population of swimming and life-saving skills, increasing the level of awareness of the dangers of aquatic activities and educating children and adults on how to be safe in and around water, and increasing the awareness of parents on the importance of supervising children aged 0 to 10. We wanted to advocate to policymakers where aquatic facilities fit in that bigger picture. What is our role in the community and in the eyes of government? We wanted to exposit how we can better align our programs and services within the broader public policy objectives. Our ultimate aim is to increase the availability and sustainability of aquatic facilities by 2030. This time, we wanted to do a study that wasn't just a raw life-saving study, but one that would capture the attention and the respect of policymakers. So we decided to partner with a respected economics partner that could deliver an authoritative account of this high-level economic analysis. As part of the process of finding a suitable partner for the economic analysis, we learned that we also wanted to look at the qualitative elements, the stories that people tell about the impact that their pool has in their life. So we partnered with PricewaterhouseCoopers for this report, but we've also engaged Swinburne University to do a part 2 to this report, looking at those qualitative elements. So let's talk about the PwC report. A 4-step process was adopted to quantify the economic, social, and health benefits of aquatic facilities. Step 1 was to identify the key purposes. What role do aquatic facilities play in society? Step 2 was to identify the activities. What do people actually do at aquatic facilities? Step 3 was to identify the benefits. What are the benefits associated with those activities undertaken at those facilities? And then we had to identify a measure for quantification. Is there data or a financial proxy that's available to turn an activity into a dollar amount? We started with a significant literature review and consultation with leading researchers and consultants in this field. We then drafted and iterated a benefits framework assessment and then tailored the benefits modeling based on the unique activities of aquatic facilities and swim schools. We needed to know what was their purpose. How can we measure this in financial terms? While there are some established proxies, we also had to develop our own using literature and data to create realistic and fair assessments of the value of some activities. From there, we created an input-output model to inform the economic analysis. Input-output models simulate the induced or flow-on impacts to other sectors of a change in one sector. So a key value of these models is providing insights into the relationships between different sectors and industries and the flow-on impacts in one sector on other sectors in an economy, the importance of certain sectors to regional, state, or national economies. This allowed us to understand the full impact of the aquatic industry on the economy, including employment and indirect benefits on interconnected industries such as transport and tourism. It also allows consideration of the flow-on impacts of changes in one sector on others, or on a region as a whole. For example, what sectors receive the greatest flow-on benefits from the aquatic industry? Interdependencies and interlinkages. For example, what are the opportunities or vulnerabilities if the aquatic industry were to grow or contract? And finally, we wanted to include the social return of investment of running the average pool. And we used financial data from the CERN-PI survey, as well as operators, and washed this against the benefit model to calculate this benefit. We then spent weeks collecting data and cleaning that data from our partners, members, and consultants, putting together the only comprehensive national aquatic facility infrastructure database of its kind for the purpose of this report. We then conducted a geospatial analysis to determine that 89% of Australians live within 20 minutes drive of a pool. We also looked at some additional benefits, both quantifiable and non-quantifiable, but identified a qualitative study would be needed to examine these elements further in depth. So let's take a quick look at the high-level overview.
For almost every Australian, the local pool has played an important role in their life as a place of recreation, learning, fun or fitness. A report prepared by PwC Australia provides an assessment of the economic, health and social benefits that accrue to individuals, communities and society as a result of activities undertaken across the Australian aquatic industry. The report found that Australia has 2,113 aquatic facilities, 1,306 public aquatic facilities, 807 publicly accessible aquatic facilities. 89% of the population live within 20 minutes drive of an aquatic facility. The national aquatic industry provides $9.1 billion in social, health and economic benefits to Australians, including economic benefits equal to $2.8 billion annually to Australian gross domestic product. Health benefits equal to $2.5 billion annually in reduced burden of disease. Additionally, the report found that the aquatic industry saves the equivalent of 7,479 disability-adjusted life years each year. For every $1 invested in operating an aquatic facility in a capital city, there is $4.87 of social return on investment to the community. For every $1 invested in operating an aquatic facility in regional Australia, there is $2.18 of social return on investment to the community. There are 67,000 workers in the aquatic industry, with a full-time equivalent of 33,600 staff. Aquatic facilities are unique in their ability to transcend many of the barriers present in other sports or social settings. They are generally safer and more accessible than other forms of physical activity, allowing people of all abilities to participate in active recreation and leisure. As Australia's population ages and we recover from the COVID-19 pandemic, the importance of aquatic facilities will continue to grow. Join us in supporting the national aquatic industry for its many benefits to the Australian way of life.
So you can see from an economic perspective, local economic activity, tourism, improved workplace productivity, improvements in property values and local tax base, and employment and vocation benefits are cited in the report. From a health perspective, aquatic facilities provide positive impacts on physical and mental health at both individual and community levels, as well as reduced absenteeism benefits, improved healthcare system impacts, and provision of a safe and supervised setting for people to familiarise themselves and build experience in aquatic safety skills. This has a related effect on reduced drowning. From a social perspective, enjoyable patron experiences and an increased sense of community and social capital are among the known benefit areas. Positive impacts on well-being, sense of community, increased social connection, and educational benefits are also accrued. From a social return of investment perspective, we learned that different types of pools in different locations have different returns. And we see an equivalent return to the AFL's earlier studies, which is actually remarkable given that aquatic facilities have much higher construction and operational costs. It shows just how many people are really impacted by their local pool and the wide reach that pools have into their local communities. There are a few significant benefits that we could either not quantify or design a proxy for. And so we didn't include those in the overall calculation. There might have also been some overlap with other factors. So these benefits included the benefits of early childhood education from learn to swim activities, likely the first formal and structured educational experience for most children. We also didn't account for the uplift in the value of housing near public pools. This modelling found that individuals were willing to pay an additional 2.1 to 3.5% of the property price to be located close to a public pool, and that was worth around $40 billion. Additionally, we need to conduct a needs analysis of aquatic facility infrastructure. This report does not include analysis on the current state of aquatic infrastructure, and we could also benefit from focused assessment of industry sections, such as a particular activity or program, or even at an individual facility level what the community impact is. Finally, while we have now identified the financial value of the quantifiable economic and health benefits through this report, a detailed understanding of the more difficult to quantify social impacts created by the aquatic industry and the infrastructure, workforce and programming that supports these social outcomes are less known and are more qualitative. As such, our next report, delivered as a collaboration between Royal Lifesaving Australia and Swinburne University, has been commissioned to inform a deep understanding of social impacts that eventuate from community engagement with aquatic facilities and swim schools, as well as presenting key foundations and optimal conditions for their delivery. Specifically, the next report will focus on social impact and provide a framework of social impact infrastructure inclusive of people, places, policies, and programs, all of which are critical to the continued and sustainable delivery of social impact. We anticipate that this report will be ready in the coming weeks. So we encourage you to read the work that we've done with PwC and our next report with Swinburne University, and join us in our work of building a water-loving Australia free from drowning, where every Australian can swim for fun, education, fitness, and/or well-being, facilitated by a vibrant and strong Australian aquatic industry. I'd like to thank Lifesaving Victoria for another fantastic aquatic industry event, and I'd like to thank our members, GSPO subscribers, and the National Aquatic Industry Committee for contributing to a safer and more sustainable aquatic industry. Thank you.